Osteoporosis is a chronic medical condition characterized by the weakening of bones, making them fragile and more susceptible to fractures. It is often referred to as a silent disease because bone loss occurs gradually and usually without any obvious symptoms until a fracture happens. This condition primarily affects older adults, particularly postmenopausal women, though men are also at risk, especially with advancing age. Understanding osteoporosis involves examining its causes, risk factors, symptoms, complications, diagnosis, and management strategies. Causes and mechanism. Osteoporosis develops when the process of bone resorption, where old bone is broken down by specialized cells called osteoclasts, outpaces bone formation by osteoblasts. This imbalance leads to a reduction in bone density and deterioration of bone microarchitecture. Bones become porous, brittle, and less able to withstand stress. Several factors contribute to this process, including hormonal changes, nutritional deficiencies, lifestyle choices, and genetic predisposition. Hormonal influence. One of the most significant contributors to osteoporosis is a decrease in estrogen levels in women during menopause. Estrogen plays a crucial role in maintaining bone density by inhibiting bone resorption. In men, lower testosterone levels with aging can similarly contribute to bone loss, although the effect tends to be slower. Other hormonal disorders, such as hyperthyroidism or excessive parathyroid hormone, can also accelerate bone loss. Nutritional and lifestyle factors. Adequate intake of calcium and vitamin D is essential for bone health. Calcium is a primary structural component of bones, while vitamin D facilitates calcium absorption from the diet. Insufficient intake of these nutrients can weaken bones over time. Lifestyle factors like smoking, excessive alcohol consumption, sedentary behavior, and inadequate weight-bearing exercise increase the risk of developing osteoporosis. Conversely, regular physical activity, particularly weight-bearing and resistance exercises, can help maintain bone strength. Risk factors. Certain populations are at higher risk for osteoporosis. These include postmenopausal women, older adults, individuals with a family history of osteoporosis, and people with low body weight or small frame size. Chronic use of medications such as corticosteroids, anticonvulsants, and certain cancer treatments can also contribute to bone loss. Additionally, medical conditions like rheumatoid arthritis, celiac disease, and chronic kidney disease may increase susceptibility. Symptoms. Osteoporosis is often asymptomatic in its early stages. As the disease progresses, individuals may experience fractures from minor falls or even routine activities. Common fracture sites include the hip, spine, and wrist. Vertebral fractures can lead to loss of height, spinal deformities such as kyphosis, hunched posture, and chronic back pain. Fractures resulting from osteoporosis can significantly impair mobility and quality of life. Diagnosis. Early detection of osteoporosis is vital to prevent fractures and manage the disease effectively. Bone mineral density, BMD, testing, most commonly via dual energy X-ray absorptiometry, DEXA, scans, is the standard diagnostic tool. These scans measure the density of bones, usually in the hip and spine, and compare it to a reference population. Blood tests may also be performed to check for calcium, vitamin D, and other markers related to bone metabolism. Complications. The most serious complications of osteoporosis are fractures, particularly of the hip and spine. Hip fractures often require surgical intervention and are associated with significant morbidity, including reduced mobility, long-term disability, and increased mortality risk in elderly patients. Vertebral fractures can lead to chronic pain, deformities, and respiratory or digestive issues due to spinal compression. Management and treatment. Osteoporosis management involves a combination of lifestyle modification, dietary supplementation, medications, and preventive measures to reduce fracture risk. Calcium and vitamin D supplementation, along with regular exercise, are foundational steps. Medications include bisphosphonates, which slow bone resorption, selective estrogen receptor modulators, SERMs, parathyroid hormone analogs that stimulate bone formation, and newer treatments such as monoclonal antibodies targeting specific pathways involved in bone metabolism. Fall prevention strategies, including balance exercises, home safety adjustments, and proper footwear, are essential in reducing fracture risk. Conclusion: osteoporosis is a progressive disease that significantly impacts bone strength and overall quality of life. Though it often goes unnoticed until a fracture occurs, early recognition, preventive measures, and appropriate treatment can effectively reduce the risk of complications. Awareness of risk factors, regular monitoring of bone health, maintaining a nutrient-rich diet, and engaging in weight-bearing exercise are key strategies for preserving bone health and managing osteoporosis throughout life.